Hello, everyone. Thank you for joining us today for Innovative Approaches to Wellness and Behavioral Health, announcing the winners of SAMHSA's 2018 Recognition of Excellence in Wellness. We have an excellent conversation prepared for you today, and we thank you all for joining us. I am Crystal Brando, the Assistant Director of SAMHSA's Program to Achieve Wellness. And before we get into the content and introduce the speakers of today's webinar, there's a quick disclaimer here that the views, opinions, and content expressed in this presentation do not necessarily reflect the views, opinions, or policies of the Center for Mental Health Services, the Substance Abuse and Mental Health Services Administration, or the U.S. Department of Health and Human Services. So once again, we're talking about innovative approaches to wellness and behavioral health, and we're going to showcase 4 organizations today who won SAMHSA's Recognition of Excellence in Wellness. The Recognition of Excellence in Wellness was announced back in February 2018 with applications due in June. The goal of the recognition is to identify and showcase innovative programs and practices that improve health outcomes for individuals with mental and/or substance use disorders, including individuals with serious mental illness. In the past, we've awarded 3 winners from the applications we received, and this year we went ahead and awarded 4. So we're really excited for you to hear from these 4 organizations and learn about the work that they do that you may be able to implement in your own organizations. But we had 4 excellent applications and couldn't select just 3 winners this year. So in order to be eligible for winning, any applicant has to be a national organization, community-based organization, which includes providers, peers, and peer providers, community, states, and tribes. Organizations that apply have to provide services or supports to individuals with mental and/or substance use disorders, and applicants have to address at least one of the 8 dimensions of wellness. And one of the things that's really important in this process is the outcomes that applicants are able to demonstrate in their applications. So the recognition winners were those that effectively worked to address the rates of chronic illness and premature death experienced by individuals in recovery from behavioral health disorders, and they're able to showcase those things with the outcomes. So when we received applications, we asked for cover sheets, narratives, 2 testimonials from individuals who received services, and that outcome documentation to show that these programs are indeed addressing these increased rates of chronic illness and premature death, helping to save lives around the country. So to talk a little bit more about the importance of wellness and recovery, I'm going to hand it over to Carlton Spate, who is the Contract Officers Representative, or CORE, at SAMHSA for SAMHSA's Program to Achieve Wellness.
Thank you so much, Crystal. I hope everyone's doing well out there. I need to talk about a little bit about the importance of wellness. As you can see, studies found that individuals with serious mental illness are 3.5 times more likely to die than the general population. I'll repeat that one more time. Studies have found that individuals with serious mental illness are 3.5 times more likely to die than the general population. I would say about 10 to 15 years ago, SAMHSA decided to do something about it. We created the Wellness Initiative, and we've been working this effort for a long time to reduce the mortality gap. And we developed the PAW contract to help provide technical assistance for communities out there who want to start their own wellness initiative, as well as create evidence-based practices that communities and individuals can take advantage of. In alignment with the Million Hearts Initiative from Department of Health and Human Services, which really focuses on heart disease and strokes and high blood pressure. We've had a strong partnership between the Wellness Initiative and the Million Hearts Initiative, and we've been able to create materials together, as well as provide various technical assistance on the different efforts from across the country. And as Crystal alluded to earlier, the individuals and organizations that received awards this year, recognition, all had created programs that focuses on the 8 dimensions of wellness, and one particular dimension for each one. And as you can see, the 8 dimensions of wellness is comprised of spiritual, intellectual, physical, environmental, financial, occupational, social. These are all things that are significant for everyone in the general population, in particular for individuals with serious mental illness. Quick drum roll, please. I would like to share with you the winners of the 2018 Recognition of Excellence Awards. Baltic Street, the Guidance Center of West Texas Seating to Eating, Mental Health Community Centers Wellness Centers, and Saratoga Community Health Center's Complementary Pain Program. Congratulations to all of the winners. Now I will be sharing, we will hear from each one of the winners as we go along. First up, we have Baltic Street.
Hi, good afternoon, everyone. This is Taina Martinez, the Program Director of Baltic Street, and I'm sitting here today with my amazing staff, Lori V. and Michael Nugent, my managers for the Network Plus ACE programs. And we're going to discuss our agency and what we do and how we do it with the 8 dimensions of wellness. Okay, so Baltic Street, our mission here is to assist participants with lived experience with SMI and dual diagnosis identify person-centered recovery and wellness goals geared around the 8 dimensions of wellness. Here, we've been in business now since 1996, and we've been able to assist those live fulfilling lives around housing, social supports, education, vocational trainings, entitlements, and other life-changing services. Each year we service around 5,000 New Yorkers, and we continue to plan to expand and grow in the next coming year. One of the things here at Baltic Street is our employment program, which is the Network Plus Assisted Competitive Employment Programs. Our goal here is to obviously assist those that are looking to improve their occupational outcomes in their lives. We help these individuals maintain and meet their employment and financial wellness goals. Here at Network Plus, we assist these individuals during the assessment process with automatically introducing each one with the 8 dimensions of wellness, which then prepares them with our psych rehab, I want to say our Choose, Get, and Keep model from BU's psych rehab. Yeah, so I'm going to introduce Ms. Veet.
So our goal, as always, has been to increase competitive employment and decrease in job separation. So one of the ways that we do this is with job follow-along. And as we all know, in this day and age of technology, there is texting, there is Skype. We also find that in order to achieve occupational wellness, that we need to go into what else would help our participants in obtaining. So one of the things that we speak about is financial literacy, where we will help somebody try to get into Ticket to Work or Pass Plan or IRWES, about the disabilities, disclosure, and we do entitlement. We're a certified entitlement benefit also.
Wait a minute.
With helping people to succeed, looks like we help also with increase affordable professional clothing. We deal with Dress for Success, follow along. We do Dress for Success, Midnight Express. We help people get access to healthy foods because we know where the food pantries are in the 5 boroughs. We also increase the employer awareness of recovery and wellness many ways, which is one with role playing, and we do what I love is the wellness wheel. And I find that if you work with the person on just one aspect, through your assessment, you're going to find out that other things are needed in becoming the whole person, which is eventually what we try to do, is make it a whole person.
Okay, so I'm Michael Nugent. I want to talk about two collaborations we have with some wonderful researchers around the country, Peggy Swarbrick, Judith Cook, and Oscar Jimenez. One of the research programs was one of the research projects was training in IPS. We're one of the first peer-run organizations to be trained in IPS. Actually, Lori's program was trained in IPS and individual placement and support services, which is an evidence-based model of employment, of supported employment. And also along with that, wellness coaching was integrated with the delivery of IPS service. And our program, our sister program, served as a control group. And we were able to find that actually implementing the wellness coaching with the individual placement and support services, we were able to increase employment outcomes for the people we served. Now we're into the phase where we'll be actually piloting that research into delivery of services, and our program will be trained in the IPS and the wellness coaching, and we'll be able to enhance our services that we're giving to the people we serve. The other project that we collaborated on with Oscar Jimenez from the New York State Psychiatric Institute has to do with the delivery of Peer 1 financial wellness services. So that also started out with surveys that we did, inquiring with people about their feelings, their feelings about their financial wellness, and also their knowledge of financial wellness. Did they know what services were available to them out in the community? And once we kind of sort of refined that, we are now in the stages again where we're actually putting that into practice through sitting down with the people we serve and talking to them, doing financial wellness assessments, and then coming up with financial wellness plans, whether a person wants to open a savings account or
maybe pay their bills, knowing how to budget, opening up bank accounts, all services that at one point or another that individuals that have been faced with major disparities in their life were never afforded these opportunities because they felt they either didn't know about the services that were offered to them, or they just never had these kind of things actually even introduced as far as a program is concerned. So.
Thanks, Tina.
You're welcome.
So these are some testimonials that we've had over the course of the fiscal years. You see some people that actually have gotten, one person who has gotten the financial wellness training, another person who's benefited from using our computers or having resumes done, and we get these kind of testimonials, year in and year out, and we're lucky that we're collaborating with the folks you collaborated with. We're now basically able to expand the services that we're providing and venture into new fields that'll help our participants more.
So to close this off, again, we have another set of testimonies here, but I do want to say that, we just don't offer one set array of service. We are finding that individuals that are coming in for employment services are now looking at their entire lives at a broader scope, because people are not. I want to say that people are whole, that we have to look at the physical, the occupation, everything that the 8 dimensions is what Baltic Street is. We've been able to provide these services now greatly for 20 years, and I do definitely see that with our collaborations that our programs are going to be able to sustain themselves for a much longer period of time in order to then introduce the next generation of those that are going to be coming in off to obtain these services. So again, that's for us, and thank you again for having us online.
Thank you very much.
Thank you so much, Baltic Street. Really appreciate it. Can you pass it to me now? Great. And so next, we will be hearing from the Guidance Center.
Hello, everyone.
And I'm passing it to you now, Alicia.
Thank you. I'm Alicia Lori Gratian, the Director of the Guidance Center of Westchester, Personalized Recovery-Oriented Services. We are so, so grateful to be recognized for this Feeding to Eating project today. The Guidance Center of Westchester offers essential and lasting support to children, teenagers, and adults who are challenged by mental illness, substance abuse, poverty, and homelessness. We empower our participants to become active members of their community through education, treatment, housing, and rehabilitative and vocational services. The Guidance Center as a whole served 5,000 individuals in 2017. Our PROS program provides adults 18 and over with serious mental illness, many also with chronic medical conditions, current or past experience of homelessness, and criminal justice histories. Within the PROS program, we provide evidence-based practice curriculum to assist participants in learning how to achieve their life goals of health and wellness, housing, education, employment, and socialization. The Feeding to Eating Healthy Living project is one of our health and wellness services that we provide. Feeding to Eating Healthy Living through Gardening Goals. The Feeding to Eating Healthy Living through Gardening project was created to provide services to those individuals in the PROS program to assist them in achieving their recovery goals, such as improving wellness, self-management skills that would include developing coping strategies, problem-solving, self-care, and relapse prevention. Also to improve symptom management skills by reducing symptoms of depression, anxiety, and anger. Improve participants' ability to avoid substance use relapse, and to support participants' progress in achieving their recovery goals. We also aim to improve physical health by learning how to eat healthy, control weight, and exercise by trying heart-healthy recipes with vegetables that they grew from seeding to eating. Provide the participants an opportunity to engage in meaningful and productive work to expand occupational skills. Help participants feel rewarded by being responsible for caring for a living plant and increasing the exposure to creating a natural, peaceful environment in an urban setting. And facilitate this sense of belonging and creating a social connection with others. The Feeding to Eating outcomes. The Feeding to Eating project has grown within the 14 months of the rollout and has shown great progress in the individuals that have had the opportunity to attend the class. We have seen an improvement in the reduction of mental health symptoms that consist of depression, anxiety, anger, and psychosis. The Feeding to Eating class is the most peaceful and relaxed class. We have no arguments in that class, and everybody loved being there. Participants who may be challenged by negative thinking, trauma, paranoia, and anger are able to focus on the educational information around gardening, nurturing the plants, and working together to teach each other. Participants who would isolate themselves from others are not only communicating in the class, but outside of the class. And participants that held anger and negativity are relaxed while tending to the vegetables and making fresh dishes for the class to eat, and then they critique their own recipes. We have seen improvements with better management of health conditions, improved nutrition, and healthy eating habits. Each recipe can be recreated at home, and the participants are more willing to try a vegetable that they have not tasted since they grew it and then prepared the meal. We also saw outcomes in the reduction of relapse from substance use by being more engaged in treatment and the recovery services. And it improved in interpersonal relationships and a sense of this belonging within the class. And then seeing the camaraderie and the ownership that each person in that class takes on It's the biggest and most rewarding observation of the Seeding to Eating project. And now I will turn this over to Kathy Hagendorf, who is a volunteer from Cornell University Extension's Master Gardeners Program. And we didn't know this at first, but we didn't know she was a Master Gardener, but she is also happens to be a really skilled and giving board member of the Guidance Center of Westchester. And when Kathy heard about this project being implemented, she decided to dedicate her time each week to make a difference in these participants' lives. Thank you, Kathy.
Hi, I'm Kathy Hagendorf, and I think Alicia just said everything you need to know about me, except that I really, really love this program. So what makes Seeding to Eating innovative? Well, we are a wellness self-management group that combines horticulture therapy, nutrition education, and heart-healthy food preparation within the existing PROS framework. We created a vegetable, herb, and flower container garden on an outdoor deck, along with an indoor green room so we could garden literally 12 months of the year. This program could easily be replicated and scaled up or down depending upon space availability. We developed our curricula and lesson plans for Seeding to Eating with materials from the horticultural therapy classes that Stephanie attends at the New York Botanical Gardens, and Seed to Supper, a course created by the Oregon Food Bank and the Oregon State University Extension for beginner gardeners. I'm a Master Gardener volunteer with the Cornell University Cooperative Extension of Westchester, where I work at Hartsbrook, a vegetable demonstration garden. The extension has been a wonderful, willing partner that has worked with us from the beginning of the project, supporting us with much-needed advice, certifying our project as a volunteer site, giving us the opportunity to have other Master Gardeners come to work with the group, and my colleagues at Hartsbrook have generously donated many of their extra seedlings each season for transplant into our garden. Seeding to Eating supports individuals with serious mental illness across all 8 dimensions in wellness. Here are just a few examples that I've observed in the class. We had a young class participant last semester who was generally interested but a little inconsistent, often turning up late, leaving early. He shared with me early in this semester that he has since gone through a substance abuse rehab program. He has become a model class participant. He's always on time, he's fully engaged in every activity, and he's really eager to help the new class members and show them the techniques that he learned last semester. And May, whose testimonial you'll hear later, eagerly looks forward to doing much of the food prep work and has amazing knife skills. She shared that she's happily utilizing skills she used in previous employment in the food service industry. And Robert, from whom you'll also hear a testimonial, has been more than happy to take on additional responsibility as the semesters progressed. He's always eager to do the watering on the terrace and has even accepted full responsibility for taking over all watering duties while Stephanie is on this week's vacation. This past spring semester, the class agreed to take on the task of creating 30 living plant centerpieces for the agency's annual benefit gala. We grew herbs and lettuces from seeds in our indoor grow room and transplanted them into decorative pots. The room was abuzz with conversation as we were all creating our own individual combinations of plants, with everyone helping and consulting with each other and commenting with so much pride on their own and others' creations. When Stephanie and I returned the next week with photos of the gala tables and I told them how much the attendees loved the centerpieces, the participants were genuinely moved and extremely proud of the part they played in the gala's success. What makes us really special, though, is the amazing dishes that we create as a group and enjoy eating together. We always seem to agree that the vegetables and herbs that we've grown ourselves from seeds produce the most delicious dishes imaginable. I'd like to read the short excerpts from the video testimonials that May and Robert were willing to film for us. From May. This class has actually saved my life a couple of times. As somebody who deals with depression and suicidal tendencies, creating life and watching something grow takes away the pain, takes away the angst, takes away the voices. For a little bit, it's the one time when I'm gardening that my mind is at ease. And from Robert, the group impacts me very much. It made me realize that I don't have to be stressed that much. The gardening has helped me with coping, which is very interesting. It makes me feel real proud of myself when people eat food we grow. It's so very important for us to get together and do this. I think that Robert says it all in that last sentence, and I hope you've gotten a sense of just how excited we all are to be part of the amazing collaboration that is the Seeding to Eating program. Thank you.
Thank you.
Thank you so much, Guidance Center. Next up, we have the Mental Health Community Center.
Well, first of all, thank you very much, Crystal and Carlton. On behalf of all Mental Health Community Centers members, staff, and Board of Directors, both Deborah and I are both honored and humbled to be awarded the 2018 National Wellness Recognition Award.
Mental Health Community Centers provides mental health and substance use recovery services to adults who have serious mental illness. We serve over 500 individuals each year, recording over 20,000 visits in our 4 wellness center locations. We integrated the 8 dimensions of wellness in 2016 into our recovery model, inclusive of wellness centers, peer services, and supportive employment.
And some of Mental Health
Community Centers will be the provider and drop-in center of choice locally, statewide, and nationally. That is part of our vision statement. MHCC instills a sense of purpose, hope, belonging, acceptance, and validation in individuals served through peer-driven services. We know recovery and treatment go hand in hand, and so we also serve as a community system of care partner, impacting public policy and promoting public awareness. We have strong relationships to our community providers, and that is vital to our member outcomes.
As we all know, as Deborah said, recovery isn't alone and treatment isn't alone. You cannot have one without the other.
We also have strong partnerships with other community resources, such as the YMCA. They provide scholarships for us. We partner with Sarasota County Health Department for wellness checks, as well as the Florida Extension Office for nutrition, cooking, and gardening services. And they also just created a wellness weight loss program for us. As well as we also have the state and county backing. Our mission at Mental Health Community Centers is to provide a safe environment promoting wellness for individuals managing their mental health, with the goal of reducing health disparities and reducing the mortality gap. We do this by the integration of the 8 dimensions of wellness along with the wellness initiatives with a focus on the social dimension. We believe our innovative recovery model has directly impacted our outcomes. Exemplary outcomes are 98% of our members remain stable and out of the acute care facilities. 90% of our members rate their participation in community activities as good or excellent. 89% of our members report they're more physically active since joining the Wellness Center. And over 99% report their self-esteem as fair, good, or excellent.
Which speaks directly to the previous slide. Okay. One of Mental Health Community Center's innovation is the authoring, if you will, of the Wellness Handbook, which is authored by our members and our staff together. As you can see, the Wellness Handbook really builds in structure. When you have structure, there are systems, and then there's process within the systems, and then there's role definition within the process, within the system that leads up to the structure. Now, when that's in place, it starts to build in predictability. And as we all are very well aware, whether you're focused on recovery or treatment, predictability breeds safety. And when people are feeling safe, whether they're, again, in recovery or treatment, they start to invest in their recovery or treatment. And then there starts to become an intrinsic value of their own personal recovery. Now, due to our wellness handbook and the structure, we're able to add all 8 dimensions of wellness in our 4 wellness centers and also in our supported employment line of service and our peer services as well.
Our wellness handbook is a 10-page document. It includes our mission, vision, and core values. We're very much mission-driven. We also include in our wellness handbook the definition of wellness, as well as SAMHSA's wellness strategies. And we literally cut and pasted that from the SAMHSA website and put it in our handbook, along with the 8 dimensions of wellness, each dimension's definition and logo. And so we review that on a regular basis, the wellness, the definition of wellness, the wellness initiatives, and then the 8 dimensions of wellness within this handbook are integrated several times each day. And so we start the day off with a community meeting, and during the community meeting, they discuss the day's events with and how the topics of the day are fitting into the 8 dimensions of wellness. And we also do that at the end of every group and then at the end of the day.
Other of our innovations, as you can see up on this slide, is the use of evidence-based practices and promising practices as well, including SAMHSA's wellness initiatives. Again, including the 8 dimensions of wellness into all aspects of mental health community centers incorporated recovery services and different lines of service.
And we were only able to do this by using consumer-operated best practices. And when we did that, we changed the culture from passive participation to active consumer-operated services. And what this did was increase recovery for the individual, family, and our community success. Some of our members' testimonies, one person said, "I don't know where I'd be if it wasn't for this program."
Another said, "The groups that I attend really made quite an impact on where I am going to go now. I'm able to progress every day still to stay on path that I'm on." And another one was, I'm still a work in progress, which shows you exactly how the value, what they place the value on their recovery.
And someone else said, we have a lot of groups that cover everything from lifestyle to your medication, how to clean your house. It teaches everything that you want to learn.
You know, and again, both Deborah and I are just thankful to be here to have this opportunity on behalf of our members. First and foremost, mental health community centers will continue to save lives, heal families, and foster a healthy community. Please be sure to visit us at www.mhcci.com. Again, thank you all very much, and we're all set.
Thank you so much, Mental Health Community Center, doing some outstanding things there. Next, we have Saratoga Community Health Center.
Thank you. This is Kathy McNeese, Program Manager at the Community Health Center. I'm here with Dr. Renee Rodriguez-Gudamont. She's our Medical Director here at Saratoga Community Health Center. And also Mike Holly has joined us. He's one of our licensed clinical social workers. The health center opened in 2013 with the mission of providing primary care, behavioral health, dental, and addiction medicine services for low-income families and individuals. Many of the patients that we serve live in low and moderate income areas, and we are largely working with patients who are recipients of Medicaid. This past year, we served over 21,000 visits, or provided over 21,000 visits to roughly over 4,000 patients. This includes about roughly 4,800 behavioral health, mental health visits, 2,600 addiction medicine visits, and over 7,000 visits in primary care for 2018. Very quickly it came to light that we need to design some unique programs to support our patients that center around the 8 dimensions of wellness. The first program that we developed roughly 3 years ago was our complementary pain management program. This was an effort to design a unique program to help patients dealing with chronic pain in a different way. And they learned how to have an approach to pain that was a more positive experience for each individual. The goals of the program are to provide a safe place for these patients to explore mind and body principles of yoga for a holistic experience of overall wellness. Individuals learn through meditation and basic yoga movements how to change their actual relationship with pain. And individuals learn nutrition and diet fundamentals to support pain reduction and overall wellness. As far as goals continued, each individual over the time of 12 weeks gathers a personal toolbox that's powerful enough to change their actual experience with pain. This is actually really exciting to see the patients go through this process and the awe that they experience when they realize that their relationship with pain is beginning to change in a positive way. Camaraderie and peer support provides a setting for nurturing meaningful connections and purpose, both within the class as they support each other and also outside of the class, which has been a wonderful transition to see. And individuals begin to understand the social and emotional stressors impacting their health and developing a strategy for wellness in a supportive and caring environment. I'm going to turn it over to Dr. Rodriguez.
So part of our outcomes were really both surprising for our participants and really nice to share with our groups. And we really did invite everyone to just try the experiments so that then they could get their unique toolbox. What we found was, one measure we looked at was medication burden, meaning all of the medications that a person was on, and 41% of our participants had a reduction in total medications. This includes medications for pain and health-related conditions. So for some, their blood pressure and diabetes improved, thereby needing less medication. 4% of our participants had an increase, and this was found when we were weaning narcotic medications, but it was a temporary increase. And then 61% of our participants were able to successfully lose weight. We addressed nutrition and movement during the course, and weight reduction by a majority of patients was seen. 77% of our patients who took the class only once were able to experience positive outcomes. Most impressively, no one had an increase in their narcotic medication use. 53% of our participants were able to discontinue narcotics completely, and 47% were able to decrease their narcotic use. Participants gained enough self-care skills to allow the vast majority to tackle narcotic use and other medications that they were taking. Should be noted that 82% of our participants had a positive PHQ-9 or depression screen, and it really just illustrates the common emotionality that's associated with pain, but it also means that pain was actively and can be actively addressed even in the midst of a depressed mood. 72% of our participants also had a dual behavioral health diagnosis, and 36% admitted to some type of trauma in the past. I suspect this number is relatively low since it's often not captured in interviews. Our program innovation is that it's based in yoga science, and we spend time explaining this when the group begins. And traditionally, many may think that yoga is the yoga that you see on television, but we explain that the yoga science is really addressing both the mind and body connection for a singular, holistic experience of wellness. And when there's a daily experience of pain, it's hard to stay focused on getting well, feeling well, and making choices that move in that direction. So individuals are able to explore physical, emotional, spiritual, and relational elements based on their readiness and interest. And as they move through the class, we're able to introduce different areas so that they can work on. Our data show that a chronic pain program focused around building self-care skills, including movement, meditation, nutrition, can successfully shift medication use for the treatment of chronic pain and can also reduce medication burden for other health-related conditions such as hypertension and diabetes. Physical and emotional resiliency are fostered along with a decreased dependence on medication. And I'm turning it over to my colleague, our therapist who actually did the group with us.
Thank you. Yeah, and part of my role in working with folks was to kind of help them take the particular modalities and approaches that they were introduced to and to develop that personal toolbox to figure out what was most effective and helpful for them, and to develop a practice, because with so many of these techniques, with all techniques, changing our old habits of ways of moving, of doing things, of thinking about ourselves and our relationships, et cetera, those habits are hard to break sometimes. So using these tools and practicing them on a regular basis was something that we encouraged, and certainly the group supported one another in doing that. Some of the particular tools or approaches that we offered to people included the exposure to a number of the healing arts, particularly energy work, for example, healing touch, Reiki, Qigong. And these are techniques, again, that work and have an impact not only on the physical level, but in addition on the emotional and spiritual level as well, and a number of people related quite strongly to this. Other topics that we covered included things like breathing, a number of different meditation approaches, including body scan, so that people develop the ability to be mindful and aware of their body without necessarily judging or attaching to their pain experience. Mantras, mindfulness, gratitude, nutrition, sleep, and the role of relationships were all part of the discussion as well. A couple of the testimonials we received, I think, pretty clearly sum up the impact for folks. Having the techniques, having clear understanding about emotional trauma and issues, having all of the tools to use was so important. And for another participant, the management of the pain without dependence on medication was quite significant. And for both of these people, as for many of our participants, what they found was not only that their sense of their pain and experience of pain changed, but their ability to kind of redefine their purpose and to engage in activities that were purposeful and meaningful to them was greatly enhanced as well. So we're really thankful that folks have been willing to participate with this and have gotten some good results. So.
Yeah, one of the other things I would add as well is that when the pain is reduced and the focus becomes less and self-wellness and self-care becomes the focus, the other dimensions are able to be explored in more detail. We've had people going back to work, volunteering, becoming peers and supports within the group, so they're more able to explore those other dimensions when they're less focused on their pain experience. It's been wonderful. Thank you.
Wonderful. Thank you so much. Again, this is Crystal, the Assistant Director of SAMHSA's Program to Achieve Wellness, and Carlton with SAMHSA We would both like to congratulate the winners of the 2018 Recognition of Excellence in Wellness once again. Thank you all so much for sharing some of the background of your organizations, goals of these specific programs that won, outcomes, innovation, and some testimonials. So it's really important to note that through the recognition, while these are wonderful organizations that we're highlighting, we're really looking at these specific programs and the impact that they have on the individuals they're designed to support. So thank you, everyone, for sharing those details, and congratulations once again. We have about 10 minutes remaining that we're going to spend with some Q&A with the participants. And a couple of questions have come in, and we're going to do our best to get through as many as possible. And I'm going to start with a kind of vague, overarching question and give it to each of the 4 winners today, if everyone would take just a minute or less to respond to it. And this question is, some of your programs are doing work that isn't quite traditional, even though it's effective and even though it may be evidence-based. It may not be perceived as traditional, like the gardening or the use of mindfulness. So if we can just go around, we'll start with Baltic Street, and just let us know, how did you get buy-in from your staff to engage in these practices that may not seem traditional?
Well, I want to say that a little history regarding Baltic Street, that this is a peer-run organization. So I want to say 98% of the staff have lived experience. So buy-in for other solutions of receiving and delivering services is actually the heart of our foundation. I bought it,
I buy it, and now I'm paying it forward.
So it's the whole for us, by us kind of service that we've been able to provide.
Great, thank you so much. And I'll hop over to Mental Health Community Center. Can you reply to that question, please?
Hi, yes, this is Jeff. I think first and foremost, it was having a very, very clear direction, a very clear mission, and a very clear vision and set of core values. And then it was really defining our scope of services, which sometimes, as you said, might not have been traditional, but it was a scope of service under our recovery model. So that's really what we did in our language and our consistency from our messaging, all very vital and very important moving forward. There obviously were some people who did not buy in, and through attrition, they chose to move on. But where we are now because of our direction, because of our vision, because of our mission, and because of our consistent language and message and scope of services as it relates to the recovery for the individuals, for their families, and for the community.
Wonderful. Thank you so much. And Saratoga.
We've had really a mission here to be community and patient focused and centered, and listening to the feedback that we get, and something that is relatively non-traditional, perhaps from a medical standpoint, is very well supported within literature. And then we involve the community, so we have practitioners within the community who volunteer their time to show their craft, such as Qigong or Reiki. And then we have participants. We really start with an invitation, and we say, you've tried the traditional stuff. How about you give this a try? There's no side effects. And what we found is that people keep coming back, and there's the social and belonging feeling. There's such a sense of safety, and then they start to have a real physical experience of improvement. So that's really the only buy-in that we needed was once they had an experience, it's really fed itself, so it was pretty simple.
Thank you so much for that, Renee. And last but not least, we'll hand that question over to the Guidance Center.
Well, with the PROS program, we have to stay innovative. We have 16-week semesters. We have different participants at different times who have different skills and educational levels, and so I get some feedback from the participants of what they're looking for and what helps them, and then present it to the staff. And this particular program, I presented it to an intern, Stephanie Natelli, who now is an employee, a mental health counselor, and she bought into it pretty quickly, and we built it from there. And the participants who were interested in it started with it, and there were other participants who were afraid because they said, I don't know how to grow anything, you know. And as they saw in the beginning, things started growing and things started happening. Everybody just wanted to be a part of it, and now we have a really strong program.
Great, thank you so much. We had 2 questions come in that relate to tobacco use and smoking cessation. So I'm just looking these over and trying to merge them a little bit. Just wondering, do any of your programs work to address tobacco use? And is that part of your modeling? Or otherwise, how do you address smoking among the individuals that you're serving? So does anyone want to speak to this first?
We do.
Yes, mental health community centers would like to address this.
Please, go right ahead. Thank you.
Are we live?
Yep.
Oh, okay. So mental health community centers, we have a smoking cessation course that's provided through the Area Health Education Unit. They also have nicotine replacement therapy. And so we offer that probably about once a quarter in each of our centers. There is a 6-week course as well as a 2-day refresher course that people can take. We have had a reduction in smoking in our centers, and so most of our members do not smoke. We do have smoking areas in at our centers. They're far away from our buildings. We make it a little uncomfortable for them. And every person that walks through the door, we ask if they use tobacco and if they're interested in signing up for courses. And the reason we did this is because we found that when people get out of the hospital, they haven't smoked for many days and weeks, and then they come to our center and their friends, their peers are smoking, and you can see that war on their face. They don't want to smoke, but they feel like it's useless. And so we really put together a campaign about smoking education. We have posters up about the health issues that smoking causes. And so I don't have any numbers, but it's been successful with the reduction in smoking.
Yeah, the reduction in smoking, and of course over time hopefully we'll have the impact on the mortality rate as we discussed earlier.
Wonderful, thank you so much. We'll hand this over. Does one other organization on the line want to address this question before we move on to another one?
The Guidance Center of Westchester, in our PROS program, we have a 16-week smoke-free course that participants could choose to attend. And when they first come in, every participant has a tobacco screening, and the courses are run by the registered nurse. So we are working towards having a smoke-free campus, but we're not there yet.
Thank you for sharing that. And I will add for participants on today's webinar in the chat box, I added 2 links. SAMHSA's Program to Achieve Wellness developed an infographic on smoking cessation among individuals with serious mental illness. So the link to access that infographic is in the chat box. And we also hosted a webinar with Dr. Mark Steinberg from Rutgers, specifically related to tobacco use and smoking cessation. And you can stream that webinar on SAMHSA's YouTube channel. The link for that is also included in the chat box. So we have a couple of questions here specific for a few organizations on the line, so we'll try to get through these relatively quickly. We have just about 3 minutes left for Q&A. So a question for Baltic Street. You mentioned that you're working with some researchers, Oscar, Judith, Peggy, how did you make connections with these individuals, and how might you recommend that other organizations on the line who want to engage in some research and evaluation build those types of connections with experts like those individuals?
Well, I want to say that the connection with these researchers, actually they approached our agency in order to work with them on their renowned research, and it's been in the works for, I want to say, over 5 years for us making the connection and us actually starting the research, which just kind of finished, I want to say, about 2 months ago, which took about a year. So you know, the best thing that I would recommend to individuals is just doing your own research in what you would like to participate with your agencies, where you would like to go in the course of innovative works or developing new evidence-based practices, and reaching out to those researchers that are currently known for those sort of things. And, you know, you have the Psych Rehab Journal, which definitely has a lot of information, and you have Columbia, which also has a wealth of information with researchers that are definitely looking into the movement of developing new innovative ways in order to put yourself out there for evidence-based.
Great. Thank you so much for sharing that information. Another question we have for a specific organization on the line is for Mental Health Community Center. Someone notes that they looked up your wellness handbook, or they're interested in looking up your wellness handbook, and is it available online somewhere?
Well, good afternoon. This is Jeff and Deb from Mental Health Community Centers. That is a terrific question. We do not have it online at this point. But that is something that we're looking to do and possibly trademark prior to doing that.
All right, thank you for addressing that. And we have time for one more very quick question. Well, hopefully it'll be quick to respond to. For Saratoga, given the national concerns around opioid misuse stemming from prescriptions for chronic pain, if an organization's interested in getting a group started similar to yours, what would you say are the first couple of steps in that process in just a minute?
Really, you can organize by getting a clinical champion, and I'm happy to share any of the work that we've done. We do have a patient or participant handbook that we use for the course. And then it's really just guiding folks during a group. I run the group with Mike Holly, so it can be facilitated by a licensed provider. And really the participants then come to their providers asking for a reduction in medication. So it's really not top-down, it's patient-driven, and they then have a desire to change their medication profile and things that they're doing. But I'm happy to help if anyone's interested.
Wonderful, thank you. And in 1 minute, the Guidance Center, I will ask you a similar question. How would you recommend someone get started with the innovative horticulture activities you've been doing? So apologies, we have just 1 minute. If you can share what you think are the first 1 or 2 steps here.
Hi, this is Kathy, the board member. I think that an important thing you could do is look into community gardens in your neighborhood. You could look into a Master Gardener program. Almost every college, every state has a extension program in one of their colleges, and every one of them has a Master Gardener program, so you could look to them to help you partner and for recommendations. And also, a lot of the seed companies that sell sell seeds also do outreach and community work. And I would recommend, if you're looking for a curriculum, the one that we mentioned from Oregon State University Extension and the OSU, whatever, the food bank in Oregon. They have an amazing, amazing curriculum that is actually free and up online for beginner gardeners, and you can use it to adapt and take whatever materials are pertinent to what you're doing. It's really for a ground garden, but we were able to adapt a lot of their lessons to our container garden. And honestly, you could start very small and grow. We started very small, and over the year, it has blossomed into a really full garden now.
Thank you so much. I know I asked you to give a lot of information in just one moment, 1 minute there, so thank you so much for taking the time to do that and giving so much detail in that minute. Unfortunately, we are out of time. It is promptly 2 o'clock Eastern. We did not get to address every question and every comment. However, we hope today's discussion was meaningful and that you learned something. As you can hear, the organizations we highlighted are more than willing to offer some peer-to-peer support and help any groups on the line get started with their own wellness efforts. So please feel free to contact us, contact Carlton, contact SAMHSA's Program to Achieve Wellness. Our email address is PAWPOA@PRAINC.com, if you can use some support with your own wellness programming. So thank you to all of our speakers. Congratulations once again, and thank you to everyone for joining us today.